Assalamu alaikum to everybody who's joining us from different parts of the world. So good evening, good morning, or wherever you are, good day. I'm Sohaila Chima. I'm the Assistant Dean for the Institute for Population Health and an Associate Professor of Clinical Population Health Sciences. So we are here with you again with a Health and You Community Wellness series today. So just as a reminder, the overall goal of the series is really to create community awareness about health and disease. And we really want, the series to be able to enhance self-care, reduce any suffering, improve the quality of life, and increase healthy longevity. Just some housekeeping. Your cameras and your microphones have been turned off. You can use the Q&A feature to type your questions and comments. You can actually just post your questions or comments even in the chat. We will be able to see them. So please go ahead and post them there if you feel more comfortable just posting them there. Questions will be addressed at the end of the session, and I will moderate the session. And just as a reminder, this is not a CME CPD activity, so no certificates of attendance will be issued. So I think we are ready to start, and it is really my honor today to be introducing our guest speaker. Of course, the topic is fantastic. As you can see, we're going to talk about how to finally get rid of your headaches. And the session will really focus on the prevalence and the impact of headaches, what is the social stigma attached to it. It will also highlight when to seek medical attention and how simple dietary and lifestyle interventions can greatly reduce headaches, in addition to other common treatments. So I am certainly looking forward to this session. And now I will go ahead and introduce our expert speaker for today, Dr. Salman Al-Jardi. He is an assistant professor of neurology at Weill Cornell Medicine in Qatar. He is also a consultant in neurology and stroke department at Hamad Medical Corporation. So Dr. Al-Jardi graduated from Weill Cornell Medicine, Qatar in 2012. Then he moved to the United States for his postgraduate training. He completed his internship in internal medicine at New York Medical College's Westchester Medical Center in 2013, and his residency in neurology at the University of Vermont Medical Center in 2016. Afterwards, he also completed a vascular neurology fellowship at the University of Iowa Hospitals and Clinics in 2017. Throughout his time in the United States, he's been heavily involved in medical student and resident education. In 2015, he was the recipient of the Arnold P. Gold Foundation Humanism and Excellence in Teaching Award. In addition, he has been a sub-investigator on multiple clinical trials focused in particular on cluster headaches and cerebrovascular disease. Currently, his research interests involve management of ischemic stroke, medical education, and healthcare quality improvement. So really looking forward to this session. Dr. Al-Jardi, thank you so much for being here with us today, and over to you.
Thank you so much, Dr. Chima. It is my honor, privilege to be here, and I hope this is educational and informative for everybody. Let me go ahead and share my slides. And if you guys can hear me okay, I will go ahead and get started. So thank you all very much for being here and for listening to me. And I'll be very happy to take questions towards the end to make sure that this is as helpful and as personalized as possible. I want to talk to you about how to finally get rid of your headaches. And really, hopefully, this is something which will prove to be beneficial on a practical sense to all of you today. So I have no disclosures except that I'm somebody who suffers from migraines myself. And so like many of you, fortunately or unfortunately, this is something of vested interest to me and everybody. So we'll briefly do an introduction. We'll touch base on the common types of headaches. We'll talk about red flags and headaches, which is essentially worrisome signs and when to go ahead and see your doctor. And then we'll get to the meat of the talk, which is how to get rid of them, how to use your lifestyle changes, and how to use new and old medications that are available to get rid of your headaches. And then we'll wrap up and take questions towards the end. So let's start with an introduction. So what is headache, right? Headache is actually the most common neurologic syndrome around the world. And in fact, it is the most common pain complaint. So I'm looking, I'm seeing about 35 participants, and I'm sure many of us have headache, and many more around the community do. It is a major contributor to missed work days. And if you can imagine, at the population level, this really impacts the productivity of the profession of people who are professionals or people who work, and then also creates a stigma towards people who don't come to work very often. They miss work, and it's associated with people looking at them a certain way and saying, oh, well, they have headache, of course, that's why. But it really is a very serious problem and something worth considering. It's a very common reason why people come to the clinics and why people go to the emergency room and why people seek medical attention. In fact, the International Headache Society has a classification of more than 150 types of primary and secondary headaches, and we'll talk about what that means in a minute. And of course, the most common and the most familiar types of headaches are tension headaches and migraine. And today we're going to focus mostly on those. And of course, we'll take questions at the end again if we have any other questions. So what are the common types of headaches? The chart I want us to kind of focus on is the division between primary and secondary headaches. And we're going to start by talking about primary headache. Primary headache means the headache is because of a problem with pain. The pain itself is the problem. Secondary headache means that there is another cause which is underlying the headache itself. So the headache isn't really the problem. The headache is secondary to a more serious cause, which is underlying the pain of the headache. So let's focus first on primary. And as you can see, the highlighted ones here are tension type and migraine. There are many others, and they're outside of the scope of this conversation, but it is something worth noting that there are several types of headaches. So tension headache, as you can see, this lady is unfortunately experiencing a tension headache, is the most common type of headache. This is something that I think most of us have felt maybe after a long day or stress at work or maybe taking exams or something like that. And so it's described as an episodic headache, meaning it happens and it goes away. But for some people, unfortunately, it is chronic. It stays for several weeks or months at a time without really going away. And again, it typically occurs after psychological stress, but even physical stress can trigger tension headaches. It mostly happens in the temples, so around the areas just between your ears and your eyes and just above there. Or sometimes it kind of happens in the back of the head and the back of the neck, where people describe the sort of muscle tension or muscle spasm that seems to be affecting their headache. This typically responds to OTC, so over-the-counter medications. And the most common medication which is used to treat is paracetamol. And of course, most of you have probably used this, and it's typically pretty effective at taking care of this headache, although sometimes you require more aggressive treatment for tension headache. The second one that we're going to talk about is migraine headache. So migraine, again, which this gentleman is experiencing, is considered the more severe form of headache for a lot of people. It's an episodic type of headache. It's typically moderate to severe in intensity, and it affects anywhere between the head and neck, but it typically happens on one side of the head. The people describe it as kind of a pulsating headache, and it's associated sometimes with neurological symptoms like auras. Most people describe either no aura at all, or they describe changes in their vision. They describe a funny smell. And sometimes people describe nausea or vomiting, or they describe being really sensitive to light or being sensitive to loud noise. They say, I just want to go into a room, turn off the light and try to sleep and be quiet. And that really seems to describe what migraines are like. It's the third most common disorder around the world if you look at a global burden of disease survey, which was conducted in 2010. And it affects people who are teenagers or younger adults. And it typically peaks in some people later in life. So it really has what we call a bimodal distribution. It happens a little bit around teenage into the 20s and early 30s. It typically goes away for people in their 40s and 50s. And then a lot of the times, unfortunately, it comes back typically in the postmenopausal period for women. And it's a headache that generally affects women more than men, unfortunately. So these are the two types of headaches that we're going to talk about today. There are many more, but we're going to focus on them in our discussion today. I think this is a really helpful diagram try to help you guys differentiate perhaps which one of the headaches you may have. Headaches are often very difficult to describe. A lot of the patients in my clinic have a hard time describing their symptoms, but perhaps this diagram may be helpful. So if you look on the left side here, you'll see the sort of pink color describes pain that's sort of around the head, perhaps affecting the temples, going all the way down to the neck. And we typically describe this as a tension headache. Migraine, on the other hand, seems to affect half of the head much more often than it does both sides of the head. And you can see reference to something called cluster headache here, which is outside, again, of the scope of this conversation, but it's another severe form of headache. This typically affects men more than women. So I just thought on the right, I would just use a different diagram, really describing the same phenomenon where people describe tension type headache or migraine. So hopefully this is helpful to differentiate. So what typically brings on these headaches? If you're somebody who suffers from headaches, you will recognize that a lot of these things will actually trigger headaches, right? Probably one of the most common causes is skipping meals. And with people's lifestyles today being involved with work, being busy, going out, a lot of the times we're tempted to skip meals. Breakfast and lunch, obviously, are probably the most commonly skipped. And this tends to trigger a lot of people's headaches, and that's why most headaches will begin mid-morning into the afternoon, because typically people have skipped either breakfast or lunch. Sleep deprivation, something that many people have become kind of accustomed to, or people are, they say, of course, I only get 5 or 6 hours of sleep a night, I'm busy. But unfortunately, sleep deprivation has been described as a very clear trigger for headaches, particularly migraine, but it also doesn't help with tension headache. Now, physical and psychological stress, I think I don't need to define to this audience what psychological stress is. I think we're all, especially after 2 years of COVID, I think we can all claim expertise on psychological stress. But physical stress can really be anything from aggressive exercise to working outside in the heat to perhaps a medical illness. So anything that causes the body to be impacted and not just the mind can also trigger these headaches. There are actually certain medications out there which will trigger headaches. And a lot of these medications are aimed at cardiac or vascular diseases, things like nitroprusside, which is a vasodilator, or aspirin dipyridamole, which is an antiplatelet medication. And there are many, many others, but these are probably some of the more common ones that people will use that will actually trigger their headaches. And there's certain foods, believe it or not, that trigger headaches for many people. Aged cheese is, if you're a cheese connoisseur, you enjoy aged cheese. It is unfortunately been described to trigger headaches. Chocolate can trigger headaches. I'm always the deliverer of bad news, and people love chocolate. Some people enjoy a glass of wine, and unfortunately, red wine can also trigger headaches. So there's a lot of different things that we can do, perhaps unknowingly, which may trigger a headache. And sometimes it doesn't trigger the headache immediately. It triggers the headache several hours later. But because of this time difference between when the trigger happens and when the headache happens, people may lose this association and fail to make the connection between the trigger and the headaches. So now that we've kind of covered what are the common types of headaches, we've described where the headaches are, what can bring them on. A lot of people say, okay, well, I have headaches. Should I go see a doctor, or should I just continue to deal with them? So you're certainly welcome to come and see a doctor, right? We're always happy to see you. And it is our mission to make you better, exactly as it is for this webinar series. And in this case, I want to talk about things that we call red flags. Red flag is really a Western term, but it's used to describe warning signs or things that if they happen, perhaps you should be more concerned and you should go seek medical care sooner rather than later. And really, the phenomenon of red flags makes you think that we're going to talk about secondary headaches. So the entire idea of, do I need to go see a doctor, is number one, are my headaches controlled or not? But two, is my headache serious? And what we mean by serious, it has nothing to do with severity. And remember, I described the stigma. Migraine can be extremely severe and very debilitating, but it's not life-threatening, right? So while we will definitely focus on the treatment for that, our concern about the well-being and safety of the patient remains, relatively calm. But red flags point us to there being a different cause, or a kind of an underlying etiology or cause for the headache And this is where we think, is it high blood pressure? Is it a brain tumor, God forbid? Is it a bleeding? Is it some other medical illness? And this is, how do we know that the headache is because of something else? So here's some red flags. Now, it's a busy slide, but I actually do want to go through them because I think it's very, very important for us to know what these are like. So how do you know if you should go see a doctor immediately for your headache? The first one is if you have a sudden onset or a rapidly worsening severe headache, thunderclap headache. This is basically what people say, this is the worst headache of my life. So if your headaches are generally mild or maybe even moderate, and then all of a sudden you have one which is very, very bad, extremely severe, it doesn't start off kind of slow, it starts off very quickly and it peaks super quick, that's a concern, and we want you to come to the emergency room to come and see us if you have something like that. If your headaches typically worsen at nighttime or early morning, we also like you to come see us. It may indicate that there is something more serious which is underlying. If you keep waking up with a headache, so if the headaches are so bad, they actually wake you up from sleep, that's something that we want you to do. If your headaches change with position, all the way down to about number 4 here, you guys. So if the headache changes with position, if you raise your head up and your headache is better, and then you bring it down and it's worse again, and you can do this consistently, not just one time. You know, sometimes people say, well, I woke up, I didn't feel good, but I kind of got up and I moved around and I felt better. That's fine. But if this happens all the time, if your headache is always consistently worse when you're laying down and it's better when you sit up, or the other way around, we definitely want you to come and see us. Now, if you have new onset headache at older age, what I mean by that is if you're, now the word older age is not great. I apologize for that. It's typically young people. You know, if you come to my clinic, if you're not 85, you're not old. But let's say you're 55, you're still pretty young, but you have a headache for the first time in your life. That's unusual, right? We just said that a lot of headaches typically happen around the 20s and 30s and maybe even teens. So when people come in their 50s and they've never had a headache before, and all of a sudden they're having headaches, we want to find out. We want to hear about this. We definitely want to make sure nothing new is going on. If you have a change in character or frequency of your headache, so if you're somebody that gets headaches once a week, but all of a sudden you're getting a headache once a day, or if your headaches are always, you know, covering your whole head, but all of a sudden they're just behind your right eye and they're always there and they only happen there now, that's something that we want to hear about. If you have focal neurologic deficits, that's a big word, but what it essentially means is if your headache doesn't come with just pain, if it comes with weakness, or if it comes with numbness on one side of the body, if it comes with difficulty speaking, if it comes with some changes in vision, we definitely want you to come to us and make sure that everything is okay. If your headache comes with a fever or a stiff neck, this may indicate that you have an infection. And we really want you to come to the emergency room if you have symptoms like this. Now, what I would like to say is a lot of the times patients come to us and they say, I have the worst headache of my life, or my headaches wake me up from sleep, or they're different. And we do an MRI and everything looks fine. So even if you have a red flag, it does not mean that something serious is going on, but it means that something serious could be going on. And because we have the technology and we have the resources, we're blessed to live in a country that does. We definitely want you to come with us to make sure that everything is okay. So now that we've discussed red flags, and you say, okay, well, maybe I have a red flag, maybe not, but I have headaches. Can you help me get rid of them? That's why I'm spending 45 minutes listening to you. So hopefully the next few slides will be beneficial, they'll be helpful, and they'll have some real practical tips to kind of help you get rid of your headaches. So here we go. How do you prevent your headaches? It turns out there's not one magic way to do it, but there's a combination of things that if we do them together, you're actually able to make a significant difference in your headaches. And this is nothing to do with medications or anything like that, but this is really just other things that we can do to talk about your headaches. So the first one is educate yourself, right? So a lot of us, unfortunately, don't really understand our headaches. Of course, I'm preaching to the crowd, right? Everybody who's here is already attending a lecture about headaches, so they're already educating themselves significantly about headaches. And it turns out there's actually a lot of things you can do. You can read books about your headaches. I'm not going to mention a book in particular, but there's many out there that you can just kind of look up and choose one. And any book really that you read by a headache specialist or by a physician should be quite helpful. You can attend support groups. A lot of people find help in sharing their experiences and also learning from other people's experiences. They've tried certain things that works for them. Of course, we don't encourage you to share treatments that are pharmacologic treatments, but sometimes hearing about a certain medication or a certain technique for treatment can help you ask your doctor about it, and that might actually be good for you. So after you understand your headache, you educate yourself about it. Now you want to understand your own headache. And we do that with things like a headache diary or headache applications. There's apps on the phone that actually help you keep track of your headaches. Now, what do I mean by this? So when patients come to my clinic, I'll say, hey, how many times do you have a headache per week? And they'll say, I don't know, maybe once or twice. And I say, when was your last headache? And they'll say, maybe I'm having one today, but sometimes they don't remember. And if I say, does your headache last 3 hours? Are there particular things that trigger your headache? They really genuinely don't remember sometimes. And that hinders the way that we're able to help them. And it's the same thing, right? If I ask you, what'd you have for dinner 3 days ago? You may remember because it's a fancy restaurant, but a lot of us don't remember. I mean, I don't. So what helps is if we actually keep track of this information. So if you happen to have a day where you're getting a lot of headache or any headache at all, it's good to just put it down in a diary. Put it in an application. You can do it on the phone if you're not somebody who likes pens. Everybody has a phone today. There are specific apps that will help you keep track of your headaches. They will ask you about what happened today. Did you eat a certain type of food? Did you exercise? Did you fly? Was the weather different? You know, it'll actually help you understand your headache a little bit better. And that leads us to the next section, which is to identify your triggers, right? The best way to prevent headaches from happening, or the best way to cure headaches, is to stop them from happening in the first place, right? Prevention is better than cure. And so if we're able to avoid triggers, and if triggers are not avoidable, if we're able to minimize their effects, we're able to significantly improve your headache. And there's some lifestyle modifications that we're going to dig into in detail a little bit. This will involve things like diet, meaning not diet as in lose weight, but diet as in the way we eat, exercise in the way we move around, and sleep. And so let's kind of move on a little bit. I show you on this slide a screenshot on the left of what a headache diary looks like. Now, as you can see, it's got kind of the days of the week, starts from Sunday. So this was culturally appropriate. And then it goes all the way down with these lists of questions. So it asks you, what time did your headache start? What time did it end? Describe the pain. What was the location of the pain? And so if you leave these questions answered, of course, if you don't have a headache, don't fill it for the day. But if you answer this, you can imagine that this is going to give you a wealth of information when you go to understand your own headache and when you take this to the doctor to help you figure out what the triggers are and how they can treat them. On the right is a double screenshot of an application. And again, I tried to delete the application name, so no commercial advertisement is happening, but this is essentially a generic app. You don't have to use this one if you recognize it. You can use any one that you want. It'll ask you, can you guess what could have triggered your headache? You know, were you stressed out? Did you have caffeine? Did you sleep? And then it'll ask you to describe where the location of the headache is, and that may help you identify the causes of your headaches. So other than triggers and other than kind of understanding your headache, let's talk about the lifestyle modifications that we can do. So what kind of diet can we use to prevent headache? Many people ask me, is keto better? Is paleo better? You know, I'm actually on some sort of low carb, medium fat, extra sugar. The truth is there's not a particular diet that works specifically for headache, but there are general principles that help you guide the way you approach your headache in terms of food, right? We genuinely recommend regular meals, right? Because as you know, as we talked about, skipping a meal is a big trigger for headache. So if you're able to have regular meals, now for you, you may not be able to eat until 5 p.m. So that's fine. You can eat at 10 a.m., 5 p.m., and 8 p.m., something like that. If there's mealtime and you're busy, you really can't keep up, but it's lunch, eat a banana. Have something in your body that allows your body to get some sort of healthy nutrition, which will help you prevent the headache from coming. Sometimes a headache can be a way of asking your body for food. So just make sure that you try to regulate your meals as much as possible. You should minimize processed foods. Now, this is, of course, general. It's healthy, but it's easy to say. But the reason why we focus on that, there's actually chemicals that enter the food when we process it. And some of these chemicals will trigger headache. So it turns out avoiding processed foods is in general a good thing for you, but it's also good to prevent your headaches. And then avoid foods that trigger headaches. And we talked about some of these, like aged cheese and chocolate, things like that. I'm not saying don't eat chocolate, but see if chocolate triggers your headache. And if it does, maybe it's not something you should eat every day. And avoid real sugary drinks. We know that those will actually cause headache. Now I put caffeine, right? Caffeine is a very interesting substance. There's been a lot of research about whether caffeine is good for you or bad for you, and depending on what Google link you open, you're going to find different information. The truth is, we kind of understand it for headache. We know that caffeine acts almost like a painkiller. So if you currently have a headache, if you have a headache today, and you drink caffeine, it's going to make your headache probably go away. Right? A lot of us feel this during things like Ramadan. When you stop drinking coffee, you start getting caffeine withdrawal headaches, and it doesn't help, right? But we think that if you have large amounts of caffeine every day, it's probably going to make your headaches worse. Doesn't happen to everybody, and everybody should kind of see how their body responds to coffee or tea or however you get your caffeine. But in general, caffeine is considered good if you're currently experiencing a headache. But on a day-to-day basis, we prefer that you don't have large amounts of caffeine. Regular amounts of caffeine, whatever that may be, is probably suitable for your body. Now, I said try to avoid things that trigger your headaches. Here's a more kind of detailed description of some of the foods that will trigger your headaches. So phenylethylamine is a substance which is found in aged cheese and chocolate. This is a substance that can definitely trigger headaches. Histamine, which happens to be in small quantities in bananas. So eating a banana is probably not going to trigger your headache, but if you eat several, it might. And if you're somebody that's very sensitive to histamine, you may trigger your headaches with bananas. Tyramine is a common substance in wine, but also in things like kimchi or pickled cucumbers or peppers, and that might trigger some people's headaches. Nitrates is one of those substances that have been described to cause headaches and other things like stomach cancer that happen to be in processed meats. So watch out for those deli meats and other types of processed meats. And then caffeine, of course, can come in all sorts of different things: coffee, tea, caffeinated beverages, pills. So just keep an eye on it, right? Again, it's not a no-no, but it's things that you want to consume in moderation. Now, what about foods that actually help headaches? So interestingly, while some foods can make your headache worse, some foods can make your headache better. And here's a list of, don't you always see how healthier foods just don't taste as good? But I mean, some of these sweet potatoes, I think, are pretty cool. But if you look at and olive oil, but if you look at the list, this actually is a list of foods that if you consume on a more regular basis, you're more likely to decrease the frequency of your headaches. And when you look at why this might happen, and you see there's a small asterisk next to it, and there's some talk down here, it says a lot of these foods have higher amounts of vitamin B2 and magnesium. And it turns out those two substances that are available in supplement form are actually clearly proven to decrease headaches. So you don't have to get them in pill form, it turns out. Magnesium is magnesium, doesn't matter how you get it. So if you get it from food, good for you. And this is one way that you can do it. So again, everything in moderation, but these are foods that are generally good for you. Now we talked about eating, right? Let's talk about movement. So we know that the human body was designed to move, and this is definitely no exception, right? So exercise is a very effective method of decreasing not just the intensity, but the frequency and duration of headache. So this has been described in scientific literature, and we know that people that exercise very clearly have better headaches. Now, some people will say, well, I have a headache now, and I don't feel like exercising. That's fine. The idea is to exercise regularly so that you decrease the days of headaches to begin with. Now, we actually know from some scientific data that aerobic exercise, things like biking or running or swimming, actually has the same effect on headaches like prescription medications. So you can honestly choose whether to exercise regularly or whether to start a medication. A lot of the times you can get the similar benefit. Sometimes you don't, but sometimes you can get the similar benefit from preventative medications and from exercise. And it turns out, like most things, exercise has a dose, right? So the higher the dose of the exercise, in this case, the intensity, the higher the benefit of the exercise, not just on your headaches, obviously, but on your cardiovascular health. But for some people, walking for 30 minutes may be intense, and for other people, climbing a wall is not intense. You have to choose exercise which is relevant to you. If you're not able to perform high intensity exercise, and a lot of people are not for many, many reasons, just walk or do things like yoga, something which is low impact, low intensity, but has clearly been shown to be beneficial. Are these exercises. So keep moving, right? Keep moving. I'm actually using science, right? So I wanted to, well, this is a talk for the general public, but I think it's good to see that a lot of these slides are actually backed up by scientific evidence. So this is a study that was published not too long ago, actually. I see that the journal citation was probably cropped, but I'm happy to provide it to you at the end if you need. This is a study that looked at the effects of aerobic exercise with relaxation and its influence on pain and migraine patients that were women. Remember, migraine is much more common. And if you look at the conclusion, it says the program led to a significant reduction of self-rated migraine pain intensity. Although there was an improvement in depression-related symptoms with the aerobic group, and it goes on to say that really the biggest impact they witnessed with exercise was on their headaches. So these women not only felt better, but they actually felt less depressed. So I think it is abundantly clear that you should definitely keep moving in order to prevent your headaches. It will show you in these two groups, if you compare the people that had very, very little, if you look at, for example, at the exercise group versus the control group, very few people in the control group, in the exercise group had intense headache versus about 33% of people in the control group. So exercise was very, very clearly associated with an improvement in headaches, sleep. If you guys don't know us, my wife and I have a cat at home. Of course, this cat is sleeping, and we recommend that you do too, right? So adequate sleep is instrumental in preventing headaches. We think that the average adult requires between 7 to 9 hours of sleep every night. We don't know what every person needs. You do. So if you are somebody that sleeps 6.5 hours and you feel good, that's great. If you're somebody that needs 10 hours of sleep, I really hope you can get that, because that's really important for you. Make sure that your body is receiving adequate amounts of sleep. Now, there are sleep problems that may actually increase your headache. An example of those is something called obstructive sleep apnea, which happens to be a difference in the way that we breathe at night. And so not only is the amount of sleep important, but the quality of the sleep is important. And so many people don't get continuously 7 hours of sleep, but they get a little nap in the afternoon. As long as you're able to sleep good, the quality of your sleep is good, quiet room, a little bit cool, dark, you're sleeping okay, you're healthy, you wake up feeling refreshed. This is very important to help you prevent sleep. So now we go from lifestyle modifications into medications and supplements and things like this. So there are things that are available to you over the counter where you do not need to see your doctor, that you will be able to receive, excuse me, to help your headaches. And there are treatments that you will need to be able to see your doctor to actually be prescribed. They're not available to you to get them without seeing your doctor. So here we go. So what are the over-the-counter stuff, right? What can you just walk into the pharmacy, drugstore, sometimes gas station, depending on where you live, and get these? There's supplements. Like we said, magnesium and riboflavin, which is vitamin B2, are very important, and they can actually help significantly. Now, I want to make a comment about vitamin B2. So it's one of the vitamin Bs, right? A lot of people will look and they can't find B2, so they'll go and buy B complex. Make sure that you actually read what's on the vitamin list, because a lot of the times vitamin B complex has B1, B6, and B12, and it will actually skip B2. So if you're targeting B2, riboflavin, make sure that it's actually on the thing that you're buying. Some other substances that have been described to really help are things like Coenzyme Q10 or CoQ10. Again, this is just available in the pharmacy. It's a supplement. You just go and you consume 1 tablet per day, and over several weeks, it should really help decrease your pain. And melatonin is another supplement which we'll describe for sleep. Excuse me, I'm having an upper respiratory infection. So there are medications, obviously, that you can use for Pain treatment, these include things like paracetamol. Many NSAIDs are available. And then there are some anti-nausea medicines. And now this has an asterisk because depending on where you live, you may be able to get these over the counter. And sometimes in some countries, they're not available. Excuse me for just one moment while I drink some water. My apologies. Okay, so here we go. So when to go see your doctor, if all of these things don't work for you, you've tried supplements, you've tried your lifestyle modifications, you've tried to eat differently, or maybe because you have a red flag, there are medications that are available that you can only get by prescription that you cannot get by yourself that are significantly effective for headaches. Now, these are classified into different categories. The category on the left is called abortive. Abortive means I'm having a headache right now. I will take this medication. My headache should go away. There are examples of these. Some of these may not be familiar to you because these are scientific names of medications, but these are very effective in treating headaches as they happen. And we will use these either in the emergency room, or we will give you the prescription so that you can take it home with you. And if you really have a bad headache attack, that you can use one of these. On the other end, we have preventative medications or preventative treatment. These are medications, if you notice, they don't have painkillers in them. They have things like blood pressure medications or anti-epileptic medications. What happened is when we use these medications on patients with headache, even if they did not have the other condition, for example, blood pressure medications may be safely prescribed, some of them, of course, to patients that don't have high blood pressure, but they experience headaches. And depending on the selection of the medication, this will help the headache without lowering their blood pressure. So they're what we call dual use medications, and a lot of preventative medications for migraine are dual use. Now, of course, you will see this fancy word here, Botox. Everybody wants to talk about this. We'll get to this in the next slide. And there are actually new and very promising medications known as CGRP inhibitors. And again, this is something that we will discuss in the next slide. So other than the medications that you saw, there are very new treatments for headache. Now, I say new, Botox, of course, is not a new medication, and it has been used for headache for a long time, but it's relatively newer depending on your treatment plan, where a lot of people don't realize that Botox, which is typically associated with cosmetic uses for the general public, can actually be used specifically for the management of head pain or headache or neck pain. And here's a picture of some of the locations where the Botox will be injected in order to help with headache. The second is actually some of these newer classes of medications. We have now injectable medication that can be used for headaches. Some of these are injected at frequencies of once a month or every few months, and they will typically significantly help your headache frequency. And the last is actually devices. So here's a picture of one of many FDA-approved devices that are used to treat and prevent headaches. They use a technique known as neuromodulation, as you can see here, through something called transcranial magnetic stimulation. So it essentially creates a magnetic field which alters the magnetism around your brain. This has been scientifically studied, and it sounds like science fiction, and in some ways it probably is, but it has been shown clearly to decrease the frequency and intensity of headaches, and they've actually been investigated and approved by the FDA. So lots of promising new things. If some of you have very severe headaches, there are a lot of treatments out there and a lot of different options that we can try to help you out. So to wrap up, and I'm just keeping track of time, headache is the most common neurologic condition and one of the many main reasons that you will go visit and see your doctor. So again, even if you don't have any of the red flags, but you're somebody whose headaches are affecting your quality of life, we would definitely like to see you so that we can help you as much as we can. While the vast majority of headaches are benign, it is definitely important to come and see us if you have any of the red flags that we talked about. And to conclude, and this really sums up the whole talk, a combination of lifestyle choices, over-the-counter medications, and prescription drugs can be used to optimally control your headache. So with this, I'm going to wrap up. I'm going to say thank you very much, and I would be very happy to take questions from the audience. Dr. Chima.
So thank you, Dr. Al-Jardi, for that fantastic session. So of course, great learning points. I'm sure the audience also has benefited greatly from it. So thank you so much for them. So I'm going to start off with some questions, for you.
Please.
So of course, we generally talk about headaches in adults, but children also sometimes come to us and
Absolutely.
say, I have a headache. So is that a real headache, or should, parents just be sort of trying to, say, oh, it's not a headache, go sleep or go do something or go play, is that a real headache when children start complaining to us, or when should we be bringing them to the physician's office?
Excellent. Excellent question, Dr. Chima. I think this is, so of course I have to acknowledge that I am not a pediatrician or pediatric neurologist when I answer this, but kids have feelings and they have sensations exactly like we do. So it may be tempting to dismiss a headache in a child, but in fact, it may not prove to be the wisest thing to do. So like adults, the majority of headaches in kids are benign, meaning we don't find a scary medical condition that was causing the headache. But it doesn't mean that the child is not suffering. It doesn't mean that they're not very uncomfortable. And I think if it's a rare occasion that they complain of a headache, they can sleep it off, or maybe just a little Panadol or something, and it makes it go away. I think it's probably fine. But if it's something that the child complains of a lot, maybe once a week, it stops them from playing, it stops them from focusing in class, I think that is something that should be taken very, very seriously, and they should be brought to the pediatrician to be seen. Absolutely.
Great, thank you. Thank you for that answer, Dr. Al-Jardi. So we've had a couple of questions, where people are asking about water therapy, or is drinking water better than taking paracetamol or aspirin, to relieve is there any such thing as water therapy to help with headaches or migraine headaches?
That's a very good question. I answer as I have a bottle of water next to me, of course. Drinking water and being hydrated is very, very important. It's something that's going to prevent headaches from happening in general. But is drinking water going to take care of your headache? Probably not. Right. So I think it's just one of those things that we have to understand how it relates to us. If we're people that generally don't consume enough water and we have a larger burden of headache in our lives, drinking more water in general may decrease the number of headaches that we have. But if I'm currently experiencing headache at the moment, we don't have any data that water would actually stop the headache as it happens. So drink more in general, but if you're in pain, I would reach for something along with the water probably.
Great. Thank you, Dr. Al-Jardi, for that answer. So I know you've, I really liked it that, of course, you started off with that. Yes, if you have headaches, maybe look at your lifestyles. I think that that's really coming out a lot, every session that we are doing, be it stress, be it depression, a lot of the cases is, okay, let's look at your lifestyle. Let's see the diet, what you're eating, how are you managing your stress, sleep. A lot of us are sleep deprived in
Of course.
today's day and age. So I think that's really important, and I loved it that you emphasized that a lot. So we do have a question about some of those things. So I know you went through those things in your slides, but maybe I will just invite you, to just reiterate again in terms of physical. If there's any particular physical activity or an exercise that I know that you said basically that any kind of movement is good for us. But if there is anything, which works better or not, to help or relieve the pain or to prevent, maybe you can just, reiterate
Absolutely.
that. And also,
Absolutely.
again, just, review again the foods that you mentioned, which may trigger or they might just bring on a headache. If you could
Excellent.
just Say
Excellent. I
that.
think that's a great question, and definitely the whole purpose is to help everybody. So I think re-emphasizing this is very important. For exercise, we think that aerobic exercise helps. So what I mean by that is typically when we think of exercise, we think of aerobic and resistance exercise or resistance training. Resistance training is things like lifting weights, or that has not been studied extensively in headache and may not actually provide the same benefit. The things that we do around that, things like running or swimming or just walking, stretching, doing yoga. Some people just like to walk on the beach. That's great. I think keeping the body moving in a way that it was designed to do is going to be very helpful. Now, which is better? Interestingly enough, it depends on the person. Some people are wonderful at running, but they don't think it helps them. When they walk, their headaches are better. So walk. I think that's it sounds really simple, and it is. And I think it
Yeah.
should be. So if you understand how you feel, it's good. And the relationship with food is very unique to every individual. Some people are able to eat 500 grams of cheese, which it's a lot, but they don't get a headache. And some people have a little bite and it triggers them. So I think this is where having a diary or an application will come in. It will really help us understand how our body is dealing with certain foods. But in general, things like aged cheese or maybe very, very dark chocolate have been associated with triggering headaches in many people. Some people get headaches from certain smells or certain perfumes. Of course, you understand how your body is, and I think really the biggest investment is to learn about yourself and how you deal with your own headache.
Yeah, great. Thank you. And I really like that, concept where you said, learn about your headache.
Yes,
I think a lot of us say, okay, it's a headache, it's come, I'll take but we don't really take that time out to, of course, we might keep a food diary because we're more
right,
worried about
exactly,
weight and, when we are trying to lose weight. But I don't think a lot of people would relate to keeping like a headache diary if it really is a
exactly,
problem.
exactly.
So we have another question about, some patients using, they're using a drug named Primaperin to treat migraines. Is this a good way for treatment?
Excellent. If I understand correctly, Primaperin is metoclopramide, which is an antiemetic medication. It's a Metoclopramide has been very well described in the abortive treatment of migraine, not the preventative treatment. So it's a medication that works by blocking a substance called dopamine, and we think dopamine plays a role in headaches. It also affects a substance called serotonin, and both of those things, serotonin probably more so, relates to headaches. So does it work? Absolutely. And migraines a lot of the times come with nausea, and of course it will help the nausea significantly, but it will also treat the headache even without nausea. I just caution with significant or long-term use, because it may have side effects that happen 10 to 15 years down the line. If we use the medication daily, it may cause abnormal movements in the face or in the body. So while it is a very, very safe medication, I think it's just important to try to use it cautiously, just like we use every other medication, but it's perfectly fine to use it for headache treatment.
Great, thank you. So we have another question about headaches related to premenstrual periods. So
Mhm.
uh, can you comment on if headaches, which happen during the premenstrual period, they can be improved with lifestyle change? I mean, rather than, because obviously you may not want to take medication all the time. Is there a mechanism where we can, again, during the premenstrual period, or, improve our lifestyle so that they can help alleviate the headaches?
Well, that's a great question, Dr. Chima. Great question. So, of course, we mentioned that migraine in particular can affect women more than men. And probably one of the reasons is because it happens a lot around the menstrual cycle. And what we think happens is the changes in the hormone that just precede or at the very beginning of a period actually trigger significant headache. People think there's no way around it, but in fact, there's a lot of things that we can do. So in addition to lifestyle changes in addition to food, which, by the way, they don't work if you start them immediately and you expect them to work today, right? It's a long-term process. So there are some of the supplements will actually help significantly. So B2 and magnesium in particular do seem to help headaches that happen around the menstrual cycle. And if they're only around then, we actually have, and they don't respond to these medications, we have treatments that we can use specifically during those days. So we actually aim for 2 days before and 3 days after. And that tends to resolve the headaches even before they happen. So it's not a lost cause. There's a lot that we can do, without affecting the health or the normal process, which is the menstrual period for women. Absolutely.
Thank you. Dr. Al-Jardi, so we have, again, some sort of a similar question, but related to hypothyroidism. So if you have hypothyroidism and if you have headaches, is there a way to eliminate, again, I mean, of course, a lot of people will be taking supplements, for the hypothyroid problem, but then if headaches are happening, is there a way to eliminate them?
That's a really good question. So this is, it's actually one of the talks that we give to our residents because it's relatively complicated to answer, but there may be three things happening. The first thing is the hypothyroidism itself may be causing the headaches, and that may be either hormonally directly or things related to being overweight because of the hypothyroidism. So treating the thyroid should technically treat the headaches. The second reason is if there is an underlying condition, typically autoimmune, which is causing both the thyroid disease and the headache, that would be the most serious cause. And that's something that would really require further workup and imaging in the hospital. And the third thing is they're both so common that they both may just happen at the same time and may not be related to each other. So while it's tempting to think that that's the cause, I think it's important to see both specialists, an endocrinologist and a neurologist, and see if there really is a connection between the two. Sometimes there isn't.
I think that's excellent advice. Thank you so much for that. So let's talk a little bit about, treatment. I know you've, of course, spoken about over-the-counter drugs, which are common. People might take aspirin or paracetamol or NSAIDs, like ibuprofen, commonly available. So again, if people do get headaches, they do take these medication, and they have relief from medication, right? So what should sort of like, okay, if people are getting frequent, again, and there might be many things happening in a person's life, like stress or whatever it is, exams or, work stress or what a life stress, whatever it is. So you take the medication, it relieves the headache. So how frequently, like should you be getting like headaches, and even if they're getting relief, when should we be reporting to the doctor, or when should, our alarm bells be ringing? Okay, I need to get this, checked.
That's an excellent question. I think that's one of the most important questions so far. So this is very common, Dr. Chima, as you would imagine, right? A lot of the times headaches get better with just ibuprofen or just paracetamol. So people say, well, good, but then they end up taking it 4 times a week. And, is that okay? While there's probably not a magic number for people, we really don't want you to be taking it for headache more than once a week, and we definitely don't want you to be taking it more than twice a week. Now, I say this, and maybe I'll spend just a minute explaining the concept. It's not that the medications will necessarily harm your body. These are relatively safe medications, and sometimes people are using them for something different, like knee pain or back pain. But unfortunately, there is a phenomenon called medication overuse headache. It's not overdose. So the doses are fine. People think I'm just taking 2 tablets, it's okay. But medication overuse has been described in many, many people. And that typically happens when you take it 8 times a month or 2 times a week. Any medicine. Ibuprofen, caffeine. Caffeine acts almost like a medication. And so when people are taking it and they think it's just coffee, when they drink it every day, it may actually worsen some people's headaches. It's just like taking a couple of tablets of another medication. So when do you tell your doctor? I think if you're using medication twice a week, you should definitely tell your doctor, even if your headaches are okay, because we can probably control them in a safer and more effective way than the way of taking medication all the time. If it's once a week and you don't seem to be affected otherwise, it's probably okay. But again, it's not a bad idea to consult the doctor. It's extremely surprising how a little lifestyle change can make a big difference. And you often just have to talk to somebody about it to figure out where you're missing your attention in life. But twice a week is kind of the red line. If you're at twice a week, definitely come to us, and we'll try to use something much safer and more effective to take care of those headaches.
Okay, so we do have a question, about the dosage of paracetamol, the maximum that a person can. Maybe you want to comment on that, but again, we definitely want to tell people that please go meet with your primary care or your neurologist. We are not giving out medical advice, and each person is so unique. So I think they have to be looked at as a whole before,
Absolutely.
right? So anyway, Dr.
Absolutely.
Jerdi, if you can maybe just, I'm not sure in what context the person is asking about the maximum dosage, but maybe if you can just comment a little bit on that, please.
Absolutely. So, of course, it's very tricky because one person is asking, but several tens of people are listening to the answer. Again, exactly as Dr. Chima said, this is a very individualized question. I will quote the FDA in saying it's a weight-based medication for kids, and for adults, the maximum dose is 4 grams or 8 tablets per day. We prefer you to be much, much lower than that. And if you're requiring to take the medication that much, even if it's safe, again, we want you to come to us because we have much more effective and much safer medications at much, much lower doses that we can give you. So while it's probably fine to take 2 or 4 or 6 every 6 or 8 hours, but we actually think that you should definitely come to us.
Great. So Dr. Al-Jardi, just one last question, before we end. So how much of these preventive medication is being used and how effective are they? So I know you spoke a little bit about, prevention of headaches. I don't think a lot of people know about those. So maybe if you can comment and elaborate a little bit more on that, please.
Great. And I think a very nice way to kind of come to a close. So when you've tried everything, or really when you're in a place where you think your headaches are affecting your life, they're really not letting you go to work every day, you're missing 1 or 2 days a month because of your headaches, or you go to work and you're not really able to focus and the computer screen is very bothersome. And I think a lot of us can relate to this. We have many medications. I can't count them. I think there are more than 30 medicines. Very safe, very effective, of course, when chosen appropriately and individually, that are typically used on a daily basis, that are not painkillers, that do not cause tolerance or dependence or addiction or any of the concerns that people have, that will typically take care of your headache. And a lot of the times we use them for about a 6-month period, and then we take the person off of the medicine, and most people are much better after the course of the medication. Some people need longer treatments, 1 year or 2 years. It's exceptionally rare that somebody's on a medication for longer than several years, but some people need that, unfortunately. But a lot of the medications are very, very effective. I think I would maybe stand in between the person and the doctor and say, no person responds to the same medication the same way, and some of this is trial and error depending on you and your body. So you may try 1 or 2 until you find the one that works perfectly for you, but a lot of them are taken on a daily basis. Now we have injectables, and the injectables can be used on a 3 to 6 month basis, and those are typically considered to be second level. So typically we would try an oral medication first. If that doesn't work, we either try a second oral or we move into an injectable medication, and those are extremely effective. And so we have a lot of options. A lot of this is available. It is not normal to have headaches every day or every other day, and we definitely want you to come to us so we can help you, so you can be the best version of you possible.
Great, thank you so much. There's one last question I'm going to
Sure.
ask because it's important, because
Yes.
I know a lot of people sometimes gravitate towards herbal medication.
Yes.
So it's the person is asking about alternative, medication, other than over the counter. So I know you've already mentioned some supplements like melatonin and, vitamin B2 and a couple of others. But again, like even for those, the dosage and everything again should be coming as recommended by the GP. So are you aware of any herbal remedies, which can be taken, as alternative medication for headache treatment?
Absolutely. So that's a great question, and I think there's an increasing interest from the public to seek non-medical treatments, and we want to support them as much as possible while maintaining that these should be studied and these should be safe and dosed appropriately. And before I answer the question, I want to encourage everybody to share with us, the doctors, what herbal medications you're taking. We're not against it. There's nothing wrong with it. But if we understand it, we can dose it better and we can avoid medications that interact with it. There are actually some medicines or some herbs that have been described to help with the pain. A lot of these are on a preventative, not an abortive basis, so taking them daily or every other day. And some of them were listed in the slide where I said ginger tea and mint. These are things that we find regularly and you can just make a drink out of it. We actually encourage that, and I think that's great. If you go further than that, there are things like feverfew tea infusions. So there are things that people are using. Those have been associated with some concerning things like some liver disease or unfortunately liver cancer, but that's not been very solidly established. So any substance, whether it's a medication or an herb, will have a dose, it will have side effects, and it will have benefit. And if you recall an old saying, the difference between a medicine and a poison is the dose. And so even when you're using an herb, just make sure that you actually discuss this with your physician. Actually, bring it with you if you can. It's super helpful because some of them have unfortunately been associated with some side effects. So there definitely are some options out there, but come and see us and we'll talk to you about them.
Great. So, Dr. Al-Jardi, generally what I do, the last thing that we finish off with is, what are some of the key pearls from your session today that you would like, our participants to take away with them? Just maybe, 3 or 4 points that they can really remember and take away with them, which is really going to help them get rid of their headaches.
That's excellent. Thank you for giving me this opportunity again. So, if you have headaches, you're not alone, and you don't have to be alone. You're not pretending. There is nothing that you're trying to run away from. But we generally believe that we need to help you as much as we can. And unfortunately, group advice doesn't always apply to a particular person. So I encourage you to come to your doctor and to seek attention for these headaches. A lot of the times, headaches are stigmatized. In some communities, it's a shame to discuss them, or it's forbidden to talk about them. And while we want to be sensitive to all cultures and very respectful, but we believe that the health of the human being should supersede all of that. And we definitely want you to come to us. We have very safe, very effective medications. And if you go to your doctor, it does not mean you're going to get a medicine. It just means you may get a different way of approaching your headache. But in order to help us help you, try to adopt healthy lifestyles, try to get a headache diary, and educate and understand yourself about and understand your headache, because that will maximize your chances of benefiting from your visit. And hopefully this has been helpful to everybody.
Definitely. Thank you so much, Dr. Al-Jardi. I think an excellent talk. It's a very common problem, and I think a lot of us tend to just dismiss it, rather than try and address it. So thank you to everybody who's attending. We have people from different parts of the world attending. So thank you to all of them. And we are really grateful to you that you all took time out. We hope that you're definitely going to, gain something out of this session and from all the others that you've been attending, and engage in self-care.